Great. All right. Good afternoon. I'm Carmel Angelo, Mendocino County CEO. Thank you all for joining us today. We are coming to you again today with another press conference with our health officer, Dr. Mimi Doohan, to discuss COVID-19. Along with Dr. Doohan, we have our partners with us today. We have Sheriff Matt Kendall. We have our school superintendents, Michelle Hutchins and Deb Cuban. And we have our Adventist Hospital representatives, Jason Wells, Dr. Parker, and Lindsay Spencer. At this time, I would like to remind the public that we have a call center, and that number is 707-234-6052. That call center is open Monday through Friday, 8 to 5, and after hours and on the weekends, the call center does roll over to our dispatch. So if you have a question, it would be great to call our call center rather than the other offices, because the call center is prepared to take your questions and field answers for you. Additionally, we have an email if you don't call and you choose to email, and that email is callcenter@mendocinocounty.org. So please feel free to email that email address or call the call center number anytime, and we will do what we can to get your answers to you as quickly as we can. At this time, I would like to turn this over to Dr. Mimi Doohan, our Public Health Officer.
Hello, everybody, those of you in the room and those of you who are connecting with us virtually. I'm Dr. Doohan. I'm your health officer. I am a family physician. I also have a PhD in molecular biology, so I understand quite a bit about viruses and how they move through communities, and I also am completing my public health studies. And I want to share that with you because I want you to know that I am really carefully following and understanding this evolving pandemic that we have, and that I believe it's important to share with you the information that we have in a very open and transparent way. So there have been rumors in the community that we have cases in Mendocino County that we're not telling people about. This is absolutely untrue. As soon as we know that we have our very first case, it will be announced. We are not going to keep this information from the public because this is important for us to all know for the safety of our community. The public health officer has roles in disaster preparedness and response, emergency response, communicable diseases, and communication and education of the public. So I'm here today to share information with you about where we're at with the COVID-19 pandemic. COVID-19 is a novel coronavirus, which is in its usual form causes the common cold. It's called novel because it's new to our population. It emerged in Wuhan, China in late December, and there was an outbreak in China of a pneumonia illness, a cluster of pneumonia illnesses. And since that time, the efforts on our planet have been to contain the spread of this disease. And so all of the efforts around the planet have been to contain COVID-19. We tried to contain it in China by limiting travelers from China coming into the United States. When it did come to the United States, we tried to contain it in the areas that it came and entered our country. And the reason why COVID-19 has now been called a pandemic is because those containment efforts were not successful. The virus is now spreading around the world, and that leads us to enter into a phase we call the mitigation phase. That's when we're trying to lessen the severity of this infection. And one of our greatest tools in mitigation, and one of our most effective weapons in a pandemic of this sort, is social distancing to slow the spread. So everything that I'm going to talk about today is going to have the message of social distancing included. That's why we say, don't shake hands, bump elbows. That's why we say stay 6 feet away from other people. That's why we say stay home when you're sick. These are all measures for social distancing so that we mitigate the effects of this infection and slow the spread. 80% of people who are exposed to COVID-19 have a mild illness. It's a flu-like illness. In general, children have been less affected. They have not, in all of China, there was a 50,000 person study that was done. You can find this on the WHO website. Only one child died. So we know certain things about this disease that are reassuring to us. We know that it's easily killed by soap and washing the hands with warm water and soap. So there are many good things about what we've learned about this disease. Nonetheless, this disease is spreading, and there are people that have been affected tragically with death. So I'm going to give you some data today. Globally, as of today, and this is information that you can readily get if you look on the CDC website, the WHO website. Globally, there are about 118,000 cases and about 4,000 deaths. About 80,000 of those cases were in China. In the United States, we have had 938 cases as of the most recent data from the CDC, 29 deaths in the entire United States in 38 states. In California, we've had 177 cases and 4 deaths. In California, the epicenter of this infection no longer being contained is in the Bay Area, so it's nearby. I want to give you some reassuring data about our local area, and I'm going to be calling out some counties and the number of cases in those counties. And I want to share that a case is someone who's had a test for COVID-19. COVID-19 is an RNA virus, and the test takes several days in most cases to come back. So it's not an immediate result that we get back. So Sonoma County has had 2 cases. Mendocino County has had 0 cases. Lake County has had 0 cases. Marin has had 3 cases, and Napa has had 0 cases up to now. And of the cases that I mentioned, Sonoma 2, Marin 3, these have all been related to the Grand Princess cruise ship, either direct travel on that cruise ship or close contact with the traveler from that cruise ship. So in this region that we're in, this more rural area, we've had 5 cases. Now, some people have really been worried about testing and saying, well, you haven't been testing people, but we have been tracking people. We've been tracking return travelers from mainland China. We, in the public health department, know who these people are, and we follow up and call them every day for 14 days after their exposure overseas or from a cruise ship like the Grand Princess. And if they remain without any illness, there's no reason to test them because they've not been sick. So we've had quite a number of return travelers. Also, our hospital partners, our clinic partners with Adventist Health have been doing a great job of evaluating patients as they come in. And if they have an influenza-like illness, and they have a positive influenza test, then we know they have a reason for their illness, and we don't need to further test them for COVID-19 because they have flu. And indeed, this is flu season. So we've been seeing, I'm sure our hospital partners can tell you, they've been very, very busy with people with influenza. So it's my opinion, based on evidence and science and what I understand about epidemiology and public health and viruses, that we do not have community spread at this time in our county of COVID-19. And we've been very much focusing then on containment, trying to contain this virus if it were to come into our community from spreading. The disease is spread by droplets, so if you cough, then those droplets fall on someone else, then they touch their face, they could get sick. So that's why much of our guidance has been about washing your hands, stay home if you're sick. If you do have a cough, put on a mask. So again, I want to repeat, and I'll say this every time that I'm asked, we will announce immediately if we have a case. We have 0 cases in Mendocino County. Okay, so I'm going to make some announcements today, and these are directives. They are not orders. If they were an order of the public health officer, that would mean my colleague, the sheriff over here, could actually intervene if that order was not followed. I am not making any orders today. What I'm going to be making are directives. So I'm going to be discussing 3 different areas. The first is mass gatherings, the second is schools, and the third is COVID-19 testing. So regarding mass gatherings, this morning the governor made an executive order, which maybe some of you have seen in the news, and you probably know what I'm about to talk about then. It was regarding mass gatherings. I'm going to be giving a directive, I am giving a directive right now as the public health officer to follow the California Department of Public Health and the governor's directive on mass gatherings. This is a social distancing directive for the remainder of the month of March. This directive relates to non-essential professional, social, and community gatherings. So let me repeat that. This directive is related to non-essential professional, social, and community gatherings. You can find on the CDPH website, and we would be glad to share this with you, the details of the California Department of Public Health's guidances regarding this executive order and the California Department of Public Health support of the governor's executive order. So this is the details which you can find. You've probably already heard about this in the media, and if not, I'm going to outline for you now. Large gatherings that include 250 people or more should be postponed or canceled. Now, I'm making this directive till the end of March. So large gatherings that include 250 people or more should be postponed or canceled. Smaller gatherings held in venues that do not allow social distancing of 6 feet per person should be postponed or canceled. Gatherings of individuals who are at high risk for severe illness from COVID-19 should be limited to no more than 10 people. So think about our elders. We know that people over 80 are more severely affected by COVID-19 than younger people. People that are 40 years of age or younger tend to have mild disease. A gathering is any event or convening that brings together people in a single room or single space at the same time, such as a room like this one. So we would not want to be in this room after now with more than 250 people, or let's say more than 200 people. Now, I have been giving a number of public talks, and one of the things I say at every talk is that this is a rapidly evolving situation, and that what I say to you at the end of the talk might actually be different a couple hours later because of the rapid evolution of the situation. I spoke yesterday to our schools and our educators, and at that time there were many questions about public gatherings, and I said no, at this time I am not directing you to cancel your events that are greater than 250 people. Today I'm telling you I am directing you to do that because of the governor's executive order and the California Department of Public Health. And why? Because in our planet, we're seeing community spread. We're seeing that our containment efforts have not been effective, and we need to take more aggressive efforts to mitigate the spread of this disease. You may see a curve shown in some media where there's like a spiky curve, and then there's a gradual curve. The spiky curve is when everyone gets sick all at once. The gradual curve is when it slows down, and we can get time to get through flu season, ramp up our hospitals that are doing such a wonderful job, get our healthcare partners in place, and make sure we're all safe. So with this topic of gatherings, again, the focus is social distancing. The next topic is about schools. We've had many questions about whether I'm going to order the closing of schools. I am not ordering the closing of schools. I am not making a directive today about the schools. What I am doing today is bringing together our school leadership to say that we are going to meet very closely in the coming days to decide what is the best thing to do for our children. Schools are not a non-essential gathering. Schools are an essential gathering. They're important for our entire society. So we need our children to stay in school as long as it's safe, and we will be working together and continuing to work very closely together to make a decision together. But I want to say that I'm fortunate to be a member of a collaborative group of county public health officers from the Bay Area. It's called the Association of Bay Area Health Officers, ABAHO. We share information on a day-to-day basis, so I'm privileged to get firsthand information from my colleagues, my public health colleagues that are in the Bay Area. Counties like Santa Clara, Santa Cruz, San Mateo, San Francisco, Alameda, Sonoma. So I'm really fortunate that I've been working with some of the greatest minds in public health in our region, and the Bay Area will be setting the standards that we will follow here in Mendocino County regarding school closures. I think we can all imagine that while there's community spread in the Bay Area, in the big city, we don't seem to have it here, but we know that we all travel back and forth to the Bay Area. There's a lot of communication between our counties. So there have been many, many discussions in the last months. You know, this outbreak happened in the end of December. We've been working on this 24/7 for, since January, mid-January for sure. There have been many, many discussions with ABAHO, the Association of Bay Area Health Officers, on when to close schools. This is one of the biggest priority topics we have. And as possible and as appropriate, we will emulate the Bay Area practices. Our guiding principle as an ABAHO regional approach to public health has been one case, close one school. So if a school got one case, we would close that school. We decided as a consortium of a region of county health departments, we would follow this together. With the H1N1 pandemic flu, we learned that school closures were only effective at slowing the spread of the disease if combined with social distancing. So you can imagine if we closed a school and then all those children went to the movie theaters and went to the shopping stores and went out in public, we would not be mitigating the spread of that disease. So we found that with H1N1 pandemic flu, that only when the school closure was linked to the children staying home or having social distancing was that effective in slowing down the pandemic. So there's some breaking news right now that we found out about through ABAHO, through the connections, is that as of 3 o'clock, all the San Francisco Unified School District's schools will be closed for 3 weeks. So there's not information publicly being shared at this time why the San Francisco Unified School Districts have made this decision, but I'm sure that will come out in the coming days. So as an ABAHO member, what I'm saying is that we are not at this time ordering or directing the schools to close, but we will closely monitor the situation in San Francisco, and in collaborative conversations, we will make a decision about what's best to do for our children. What is fortunate is we're about to get into spring break, and we also are coming to the end of flu season, and we're also warming up the weather. So, when our children can get outside and have some social distancing, and flu season is behind us, we're going to be in a much better situation. So again, we want to slow the spread of COVID-19. The final topic I want to discuss today is COVID-19 testing. This has been a really controversial topic in our nation. There's been a limitation of the number of tests that we could get here in Mendocino County. Initially, we could only get tests from the CDC, and we didn't have them here, and there were very, very strict criteria about who would qualify for testing, and we didn't have anybody who qualified for testing in our county. Last week, at the end of the week, actually right after the last press conference I gave when I said we were waiting for commercial testing, immediately after it broke that we had commercial testing. Well, this was really terrific because now commercial labs and our hospital and clinic partners have the ability to test. And public health can still do testing when needed. We do not have there's only 18 labs in the state of California that can do public health testing for COVID-19 at this time. The closest lab to us is in Santa Rosa, and that lab has limited capacity to process the samples that are required. Public health does not gather samples for COVID-19 testing. Those are gathered by the clinicians seeing the patient, and then those samples are sent to laboratories outside of our region. So for COVID-19 testing by the Public Health Department, the Public Health Department participates with certain testing by transporting those samples, consulting with the doctors and clinicians, and communicating with the CDC. So it's reassuring that we haven't actually, since we had testing in the last week, found cases that qualified for testing, even though we had loosened criteria. So we are continuing, though, to very closely monitor those people in the community that might become sick. And I want to share with you that we've been meeting with public health with the skilled nursing facility leadership. And next week, we are going to do some targeted testing in our skilled nursing facilities through the public health department to really take a look at whether our frail elders who are living in skilled nursing facilities have COVID-19 that we might not have detected. So this will be a focus. They already can test in the nursing homes, but we're going to do a targeted focus evaluation of the nursing home populations. So from the public health perspective, we're focusing on testing high-risk populations that reside in skilled nursing facilities in the immediate future, long-term care facilities, and that's because of what's been happening in Seattle, Washington, in the Seattle, Washington area, where it's been such a tragic outbreak of COVID-19 in the nursing homes. So to finish up here today, I'd like to reiterate that a key factor in containing or reducing the risk of COVID-19 spread is social distancing. And as appropriate, Mendocino County will follow the Association of Bay Area Public Health Officers in our practices and in our response to COVID-19. So I'd like to thank you for coming today, and we'll open up to questions, and you can also please address your questions to our partners who are standing here next to me. Thank you very much.
Are there commercial labs doing testing in Mendocino County at this time?
Yes, Quest and LabCorp. And what I heard today in a briefing from the governor is that Quest has had such an overwhelming demand on testing that they are actually backed up in their capacity. We're hoping that that will change soon. But that really lifts up for us that we need to prioritize testing for people that are sick and that have risk. So I would really like to encourage our population, if you're a well person, maybe you have a little bit of sniffles, that's not the time to get a COVID-19 test. COVID-19 generally, in over 80% of people, presents with fever of 100.4 or greater and cough, signs of a lower respiratory infection. But yes, we do have commercial testing. The clinics and the hospitals are able to order that test themselves. But the processing is not done in our county. So the samples are sent to those laboratory centers where they do the actual test, the reverse PCR test. Do you want to speak to that? Yeah.
This is Dr. Parker. I work with Adventist Health, Mendocino County. We do have testing in all our hospitals here in Willits, Howard Memorial Hospital, and Ukiah Adventist, Ukiah Valley Hospital. We work with a different lab. It's called ARUP, A-R-U-P, and we collect the sample and we send to them. The turnaround time is 1 to 3 days. And so we are able to do that both in the hospital and in the clinics. Thank you.
Should I grab it? Can you tell us how many total tests have been completed for people, have been sent out, and how many have actually been completed?
So I can tell you how many public health has done. And sorry, I'm looking for my notes. My great colleague gave me the exact numbers, but I'm going to have to go from memory. Public health has done one test because only one person met criteria that we became aware of for testing. Commercial testing, we don't know how many tests have been done, except if the clinicians report it to us. So what we've done in the public health department is asked any of the clinicians who've done COVID-19 testing to let us know that they've done the testing. But there could be more that have done the testing and just not let us know. If it's a positive test, it's immediately reportable, and so we will be immediately informed if there's a positive. What I know, it was about 11 tests that we were told have been done, and I'm looking at it, and 5 negatives. So there were 11 tests that were reported to us from commercial testing that clinics did, and 5 of them were negative. So that means some remain. to be reported, which we will know in the next couple days.
Can someone from the county talk a little bit about continuity of services in case there's a decision to have people work from home at the county, or if people need to be out sick at the county?
I'll ask our CEO, Carmel Angelo, to come and give the response.
I don't know if I should touch this, huh? Carmel Angelo, Mendocino County CEO, thank you very much for the question. We have been spending time working with our department heads and our staff. We have had 2 staff meetings to discuss continuity of operations and also the human resources policies that we are currently developing. So we're developing a COVID-19 policy for the organization. We have an organization of 1,200 people to assure that all the departments are uniformly responding to either any concerns from the employees or the public. Additionally, we are looking at leave policies, and then again, which services are essential services and which are non-essential. So to answer your question, all essential services, all emergency services, all 24/7 facilities are open, and we expect them to be open. At this time, we've had the department heads actually look not only at their services, but what they can do to be 2 and 3 deep within their departments. Was that an answer to your question, or is there more?
So I know the current directive is in place till the end of March, and we're having an unusually warm spring. And so I don't know if there's been any consideration to what might occur if there was a simultaneous power shutoff and sort of some of these measures in place, or multiple disasters at once.
Well, thank you. And we have thought about that, but what we've thought of is that the COVID-19 will take us right up to PSPS. So we have an emergency operations center. We have our Health and Human Services Department that is also teed up in response mode. And so we think we will just keep doing this all year long. But in case of having COVID-19 and a PSPS at the same time, I imagine that with the experience we had in 2019 with PSPS and our experience right now, that we will be ready. Again, we haven't thought about having both events at the same time. We've thought that we would go from one to the other. But if we do have them both at the same time, we absolutely could respond. And again, what we've done within our county system is work with our legislators and our statewide associations and PG&E to assure that we don't have another 120-hour PSPS. And while we don't have the control over that, I think we've worked with the different partners and with PG&E long enough where our hope is that we won't have a protracted PSPS. So I hope I've answered your question, Kate. Thank you.
Miss Angelo. It's me. And I don't mean to put you on the spot, but I think this is a perfect opportunity to, at least when we talk about county services, to just say a little bit till we get it analyzed, what the governor did as far as Brown Act and public meetings.
Okay, all right. Well, thank you, Supervisor Brown, for that question. For those of you that saw the governor's executive order, over the last few days, the chief councils throughout the 58 counties, along with our statewide associations, have been researching the possibility of doing Brown Act compliant meetings from other sites. So basically, you all know that if our Brown Act meeting, like our Board of Supervisors meetings, we have them in here, we have public comment. If one of our supervisors is out of town, they have to post where that location is. The concern is that something may happen quickly. We may not be able to post the location of a member, whether it's this county or another county. So the governor gave a directive, or actually an executive order this morning, relaxing and changing some of those Brown Act requirements. One of them being a 72-hour requirement where possibly we could have changes to a Brown Act required meeting much sooner within a 72-hour period. Along with that, you have a combination of a Brown Act requirement and other legal requirements. So some of those have been relaxed so that you could have a meeting with not all of your members in a location that is actually disclosed. So more to come on that, and we have our Chief Counsel, Christian Curtis, who is actually reviewing all of this and will be giving that information to our Board of Supervisors. We also know that some of our other partners within the county are looking at the Brown Act requirements for their meetings and relaxing those meetings as well. Yes, and additionally, we're looking at either canceling, rescheduling, postponing meetings that we do not see as non-essential. We've had 2 meetings scheduled for March 23rd and March 24th that are Board of Supervisors meetings. We have canceled the March 23rd Board of Supervisors workshop. And right now, we do have our March 24th Board of Supervisors meeting happening that Tuesday. Thank you.
I wanted to confirm something that you said earlier. You said that it's your opinion that that community spread has not begun to occur in Mendocino County?
Yeah,
Okay. And then the second question to follow up
that
on,
was a yes.
Okay. To follow up on what Kate said, in the case of an evacuation having to happen, what would that look like given social distancing and the need to evacuate from, say, a wildfire?
Well, it's a great question, and we have to think about just, our vulnerable individuals. Consider that we have a homeless shelter open right now, and so you can be sure that we're doing a lot of thinking and planning about how to best care for our people that live in congregate settings in case they were to become ill, and there's planning and discussions happening now to consider what we might do to move people into alternate housing.
So speaking of alternate housing, in CEO Carmelangelo's CEO report this week, we learned that alternative housing is a huge challenge to set up where people could be isolated or quarantined if they can't stay at home and they don't need to be in the hospital. And I'm wondering if there's any development on that.
Well, I can say we're definitely working on it and looking into options. And, leaders in the nation have been in Seattle. I mean, I don't know if you've been following those stories where they've been. Do you want to mention? Yeah. So, I mean, they're like, you can rent an entire motel. You can put people in houses that you rent because this virus is actually pretty easy to kill, and once the person's not sick anymore, it's not going to persist in that house. So it's not like we're putting the public at danger if we were to rent a house and have somebody in the house while they were getting better, or people exposed in that house while they were getting better. But Carmel.
Thank you. Thank you. I just want to say that we have 2 houses right now. One, we have the approval to utilize that as an alternative housing. The second one, we're working on that approval. So we definitely have a resource right now if we need to move someone into alternative housing. I think that Dr. Doohan talked about hotels, motels versus houses, and we have that is something that we are researching for additional alternative housing through the Emergency Operations Center.
And are those in Ukiah or they're throughout the county?
I can't say right now.
But it doesn't, for any of you who know about RNA viruses, they die really easily. So it's not putting any danger to the public to have short-term housing.
Have you been working with home health care workers and setting up protocols around that? Those people are servicing lots of people, vulnerable populations.
Yeah, so we started this week with our skilled nursing facility workers and facilities in our county, and then we're moving towards long-term care facilities and those. I mean, really, all of our healthcare workers are one of the groups that are at the highest risk of exposure to COVID-19. So all of our healthcare workers are part of who we're wanting to work with for mitigation. So, for example, you want to be sure that if somebody's sick, you don't want to have that healthcare worker exposed to a sick person without them having personal protection and guidance.
So I was wondering if either Sheriff Kendall or maybe someone from the county could talk a little bit more about the protections in place or the procedures in place currently at the county jail, and also how that might potentially impact court proceedings, because certainly the courthouse is a place where it's hard to do social distancing, in my experience.
And that's an excellent question. One of the procedures that we have in place right off the get-go is to make sure that we don't have a sick person enter the jail. And so we have a new screening system where they don't actually go into the jail. Our healthcare professionals that are working over there are making sure that we don't bring one in who is of that risk nature, who is showing symptoms. If we had someone like that, we would immediately take them to the hospital. The second portion of it is our folks working in the jail, working with the healthcare providers and whatnot, we're providing them with all of their personal protective equipment, and we're using basically a heightened awareness when it comes to cleaning all the services in the jail. So we haven't had anything in there. We don't want it to come in there, and we're doing everything that we can to keep it from moving in.
Do you have an idea of how much these tests cost? If you go in to get a test, what that actually looks like for someone trying to get a test?
So the public health department, the testing is free. I do not know the answer about the commercial testing. I'm sorry, I don't know the answer to that. Do you have it? I do know, I'm sorry I'm not going to give you a really detailed answer, but I do know that Partnership Health Plan did put in benefits in place so that people will not be charged extra. Please research this yourself, but I know that Partnership Health Plan came out with funding to support additional payment so that people who are on Partnership Health Plan will not be charged for the test. So if they're on Medi-Cal, Partnership Health Plan Medi-Cal, there's that benefit coming. I don't know about private insurances.
Unfortunately, I cannot give you that number. What I believe is the case is that there is no co-pay if one does the test. So it would be just like any other test. No, however much it costs, one is not going to have any extra payment for that.
So you've talked about various population groups, children, elderly. I'm just wondering if there's a plan to deal with the homeless population?
Well, we're very concerned about people living in congregate settings. So for people that are living in the winter shelter right now, we are concerned, and we have been planning and discussing how to help mitigate COVID-19 if it were to come into our community and have community spread. That the solution would be this alternate housing that we're talking about. So the solution is that if somebody's sick, being able to provide them with alternate housing so that they're not in a congregate setting anymore. So that would be our approach, yeah. I wanted to mention something that there's been a lot of confusion about. You know that there was a presidential advisory about travel from China on February 3rd, and at that time, only U.S. persons could come back into the country, into the United States from China. And so at that time, we were contacted if there was any traveler, a U.S. person from China coming back into Mendocino County. And so then what would happen is that I would become aware of that. Our health department, our public health nurse, Sharon Convery, would reach out to that individual who was already told at their port of entry that this would happen. And at the port of entry, they could only go home if they were asymptomatic, if they had no fever, no cough. So they come back to their home county, we know about them, we call them, and they had to stay home on home quarantine for 14 days from their last exposure with active monitoring from the public health department. Those people were not symptomatic, were never tested. Those are not cases. Those are not sick people. Those are people who are doing a very good job of protecting the rest of us by staying home so that if they did happen to get sick, they wouldn't have spread the disease. So we've been monitoring a number of these return travelers, both from mainland China over time. This has been going on for weeks, and also from the cruise ships, the high-profile cruise ships where there are outbreaks. Now that we have the new travel restrictions from Europe, we are also going to be getting notices about returning U.S. persons from Europe, and we will be monitoring those people on home quarantine as well. So I just want to be very clear that when we're monitoring people at home and they have no symptoms, they're not cases. And I think there's been rumors that have come about because there was kind of this knowledge that this person was at home being monitored, but they were never sick. We never tested any of them because they never got sick.
Earlier, you made the distinction between a directive, which is what you're doing now, and an order. Yeah. What's the criteria for that threshold being crossed where you do start to make public health orders enforceable by the sheriff?
Well, Santa Clara this week just made an order of the health officer for banning gatherings larger than 1,000, non-essential gatherings. So that was an example of an order. And why they did that had to do with the fact that there is such widespread community transmission of the disease, and they just absolutely want to make sure none of those events occur. If they did, the sheriff would come and shut them down. I think one can use an order when you're so concerned about your public safety that you want to make absolutely certain that nothing will risk the safety of the population. We don't have any situation even near that in our community. Everyone's been so cooperative, and there's no reason why I would think I would have to make an order at this time.
At the risk of forcing you to conjecture, how long do you think this is going to last? I know it's a lot of conjecture.
Well, I really don't know. I'm sorry. I don't think anybody does. So. Oh yeah. I would like to give the opportunity to my colleagues to say some words if you'd like to. It looks like the questions have completed, and so if you'd like to say any words at all, please feel free.
Michelle Hutchins, County Superintendent of Schools. I think the only thing I could reiterate is that we are working really closely, as you can see today, with public health. We are advising that our schools do follow the governor's office and the state of California released this morning, as our public health officer is also directing. Just want to reiterate that we are working very closely and that it is a priority for us to keep our schools open. Thank you.
Hi there, I'm Jason Wells, President of Adventist Health in Mendocino County. Our team has been ready for this for a long time. This is what we do. We treat infectious disease on a daily basis. And we're also supported by a great parent organization, Adventist Health, with hospitals in 3 states, and we serve in over 60 counties, our communities. Right now, we have implemented some new measures today. We would like to have only 1 visitor per patient in our hospitals. We realize that loved ones being a part of the care process is essential, and we have care partners, but keeping that to 1 will be tremendously helpful as we work on social distancing. We are also limiting our meetings with Adventist Health Hospitals in Mendocino County to 10 individuals or fewer. So many of our meetings will be done virtually. We have over 1,000 employees between the 2 hospitals in Willits here in Ukiah. And so limiting those to 10, we are canceling all public gatherings. We do many community educations, and those would just need to be virtual or under 10. And so we will continue to CPR classes, things like that. We will just be limiting that to 10 and under and following some of those CDC guidelines. We're canceling all business travel between our hospitals across the 3 states as we work to keep our essential team members safe. We need to be prepared for what what may come, these healthcare workers are on the front lines, and it's absolutely essential that we remain healthy. And so we appreciate that. We've had a number of phone calls about, as Dr. Doohan shared, we believe you have a positive case and you have a right to tell us. Absolutely, we have not had a positive case, and we partner with Dr. Doohan, and she will be making those announcements if and when that does come to Mendocino County. But the phone calls would be helpful to, Dr. Doohan, full transparency. This will be shared if and when we get to that point. We do have our surge tents ready at both hospitals. Don't be alarmed when you see those. That is just being well prepared should that come to Mendocino County, and there's a lot of water that has to go under the bridge before we would see a surge here. I would expect, I won't conjecture, I'll let Dr. Doohan take some of those things, but I don't think those would be used anytime soon. We are encouraging our non-essential team members to work from home. And so we have probably 90% of our team members at the two hospitals are in direct patient care or serving those that do. We are not limiting any services. Elective surgeries are continuing, and we continue to provide the full services of care. We would like patients to call ahead. If you're calling for your primary care and you have a fever, we would like you to call the office. We are seeing patients in the parking lot. We're trying to have that social distancing and avoid that in our waiting areas. And the same with the emergency department. If you have a fever, we have patients today calling the emergency department, and we're doing some triage outside of the lobby and keeping that apart. And I know that many of our other community partners are doing the same in all the healthcare clinics across Mendocino County. Thank you. Absolutely.
Could you explain what a surge tent is for people that might not know and what that would look like?
Absolutely. I'm going to turn to my colleague, Lindsay Spencer, who is the expert in surge tents.
So another name for the tent would be a triage tent. So once we start seeing an influx of patients, respiratory patients, it would be a way for us to segregate patients out of the four walls of the hospital while we're doing preliminary testing. So we're not there yet. We have other ways that we can surge and meet demands and keep the social distancing while still caring for patients within the emergency department and the clinics. But when we are there, we have worked through what that would look like in an outside location.
Deb Cuban, Superintendent for Ukiah Unified School District, and I just wanted to add to Superintendent Hutchins' statements. We are working together collaboratively of superintendents throughout our school districts. We've had two conference calls this week, and we are, our goal is to stay open as long as it's safe and healthy for kids in our community. We are definitely supporting and emphasizing all of the safe practices that Dr. Doohan spoke about. Effective today, we will be implementing the governor's advisement around public gatherings. We've also done a lot of work. I know our school districts across the county have done a lot of work in the event of school closure to try and prepare for supplemental instruction to continue to happen for our students. They only go to school 180 days a year. Many of us in Ukiah Unified, we've already lost 3 days this year due to power shutdowns. We have every intention of providing supplemental instruction at home. And so I know all of our school districts have been working on that. In Ukiah Unified, we have polled all of our staff to ask about internet connectivity. We've also today did a survey of all of our students in grades 6 through 12 to ask them about their internet connectivity to make sure that if students don't have internet at home, we provide them packets, hard copies of packets to go home. So we will be communicating with our families tomorrow about how that might work if in the event we have to close. But it is on the mind most definitely, and I can speak for all of the superintendents in our county that we are preparing for that possibility. And we really appreciate all of the great communication that you've provided and the support from Mendocino County Office of Ed.
I just wanted to be able to reiterate that the Sheriff's Office is going to continue to work closely through and with the Office of Emergency Services to support Dr. Doohan and Public Health in this. We're doing our absolute best to make sure we follow best practices to keep our first responders, as well as everyone working in and around the 951 LoCap complex, safe and healthy. Thank you.
So in closing, I just want to really thank you for your questions. We want to answer the questions of our community. We want to be in touch with our community. Oh, there was a question. One more question.
If you could just clearly reiterate to everybody watching, what are the criteria under which you should ask to be tested, like call in and ask to be tested, and what are the criteria where you don't need to and you're just swamping the system?
That's a great question. So, good. Thank you, Reader. Very, very smart community member asking a great question. We really do appreciate those questions. Well, first of all, I want to highlight who are the people that are at most risk in our community for harm from COVID-19. It's our healthcare workers and it's our elders. So we want to prioritize our healthcare workers and our elders. If they were to get sick, we want to be sure that there's enough tests for them, because they're the ones who have the highest risk of being harmed by this infection. So what we know, as I mentioned, there was in China, from Wuhan, there were 50,000 cases of COVID-19 that were studied. You can look this up on the WHO website, and we can see what were the common presenting signs for COVID-19 was fever greater than 100.4 and cough, which is a lower respiratory symptom. So if somebody does not have a fever and does not have a cough, that would not be a person that I would think would be wanting to request a COVID-19 test, because they're not having the symptoms that are consistent with that. But if somebody's sick, they should call their healthcare provider if they're concerned. And I know it's not, I'm a primary care doctor, I've worked in hospitals, so I know it's not so easy always necessarily to get through right in the moment when you want to talk. But the healthcare system is there for people when they need it. So I would say that if you're, of course, if you're sick, you should call ahead and you should discuss with the provider what your symptoms are, and in collaboration with your provider, decide whether testing is appropriate. Please listen to your clinicians, because they may say, you know what, I really don't think you have COVID-19. I really don't recommend a test. And I've been hearing about people, even though their good provider is saying that, are demanding testing, which isn't really a good practice for our community. So again, fever, lower respiratory symptoms, and in particular, our elders, our healthcare workers. And then of course, if you have an exposure to somebody who has had COVID-19, that would be another reason. But we don't have in our community that situation yet. Okay, one more question. Yes.
For those people who doesn't have an insurance or don't qualify for medical or partnership, or doesn't have a social security, and they are afraid to go to ER and get a bill for that visit. Are there any tests available at public health, or is there any way that those people who are experiencing some symptoms, they can feel comfortable to go in a place and don't charge it too much?
Thank you for that question. We don't do it. Public health, some public health departments actually have a clinic or a hospital. We don't have that in our public health department, so we actually don't directly care for patients in our public health department. We support our healthcare partners, so we wouldn't be able to do the physical exam and do the testing or sampling in public health. But we have our safety net clinics in Mendocino County, like Mendocino Community Health Center. Did I say that right? MCHC Center, MCHC, which their mission is to serve people who are uninsured. So I would say that you definitely, any person who doesn't have a primary care clinician should establish care with our FQHC clinics, and that's the mission. That's what we love these clinics so much. So I would start with that, but I'm sure I can speak for our hospital, Adventist Health, that there is no turning anyone away.
Right. Thank you.
There's no turning anyone away. If you're sick, they're there to help. But you want to establish with primary care, because so often, as I said, 80% of the cases are mild. So you're not going to need to go to the emergency department. What you really need to do is contact your primary care. Okay. So thank you very much, everybody, for your questions and the great conversation. We will be doing more press conferences, I'm sure, because today, we did this one today. We scheduled it this morning. We decided to have one because of the governor's orders. And that's when we knew about that, we said, okay, we need to have a press conference today. We'll be having others. We want to communicate with our community and be very transparent with you. So thank you so much for the great questions and for our colleagues being up here today. Thank you. Thank you. Thank you all so much.